Hello, welcome back to the Ageless Pet Podcast. This is season 2. Two.
Oof.
We did it.
Okay.
All right, we had a good time off. We were busy.
Yes, life got in the way of
Life
recording.
got in the way, but now we're back.
Yep, we have a lot of stuff to cover this
We
season.
do. We do. We're going to start with some low-hanging fruit, though. We're just going to keep it easy.
Yeah, since this is kind of what we do, we're like, let's start with something we know really, 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 really well.
Yeah, and we'll try not to get too into the weeds with it, because we certainly can. But we're going to talk about canine rehabilitation therapy. It's human physical therapy, but that's a protected term, so we say rehab therapy. And that's something we're going to talk about today. And we're going to describe what we do, but we're not going to get really detailed about each modality. We'll definitely cover that in future episodes.
Yeah. I'm definitely at fault of saying physical therapy all the time, and get corrected frequently.
That's okay.
But I just think I use it all the time because people understand what that
Absolutely.
means. But it is a protected term used for humans, not for animals. So that's what we wanted to cover today was rehabilitation therapy. So what is rehabilitation therapy? In summary, it's just a form of another kind of veterinary care that's specifically focused on improving your dog's or your animal's comfort, mobility, and strength, and overall quality of life. And this is targeted, it's done by targeting non-surgical therapeutic techniques. So obviously surgery is a whole different animal, but oftentimes goes hand in hand with rehab as well. But it is, like we said, similar to the concepts of physical therapy in humans, but it's tailored specifically to animals, taking into mind their anatomy, their behavior, and their medical needs.
Right.
So it's a lot.
Yeah, it's pretty involved. And you said animals, which is great because everybody thinks of like dogs. Or horses. Everybody thinks horses.
Yeah.
That's a huge one. But, we do rehabilitation therapy on cats quite a bit. Chickens, birds, zoo animals, farm animals.
Yeah, I was watching a show the other day. I can't remember what it was, but something with rehabbing, cows and sheep. And so you got to remember the first acupuncture, stuff that happened back in China was on farm animals. So it's all about economic needs, unfortunately, but it's kind of the way it is. But so it really covers every animal.
Yeah.
I mean, not to toot your horn or anything, but Dr. Varco does go to the zoo frequently and helps with some of those zoo animals as well. So
yeah, they do a fantastic job there. I'm really impressed.
It's crazy.
I'm really impressed. But just in general, over the years, just seeing what my colleagues and friends and I end up rehabbing, just various animals, and you're like, this is awesome, so
it is fun.
Yeah. And what kind of things do you see walk in the door? What do you think it can help?
So many different things that happens. As I said earlier, it goes hand in hand with surgery, as most people know, obviously. With like my wife had a knee surgery, I don't know, 15 years ago now, and immediately day 2 or after surgery, day 1 after surgery, I guess I want you to go on the bike and start moving that leg around. So so post-surgical stuff is really, really important. I think, arthritis and chronic pain is another thing that's super, super important that we see all the time. Other things that are very common, of course, in our industry with small animals is tendon and ligament injuries, like a cranial cruciate ligament problem, post-surgical, and some without surgery oftentimes come in the door as well. Neurologic disorders are super common as well, whether it's surgical back problems or degeneration conditions or, geriatric onset, paresis and paralysis, that kind of stuff. Obesity-related mobility issues. Obviously, there's a lot to unpack there. No pun intended, but age-related weakness and stiffness, of course, that kind of goes along with some of the arthritis, but as many of us know, as we've gotten older, we're not as limber as we used to be. Right. That's for sure. And then one thing that I wasn't really too experienced with before we added Aqua Animal Care Center here, where we started doing our rehab and everything, I wasn't really familiar with working with a lot of these performance or working dogs and conditioning on these dogs as well. So, but since we've been doing it, we see a lot of those, agility dogs and flyball dogs and herding dogs. I mean, sure, I'm missing a ton more, but we just had a client who went to Italy for their masters, and do you remember what that was?
It was protection work.
Is that what they call it, protection work?
It's
There's a
IPO.
name
There's
for it.
all these different ones, yeah.
Yeah, so he did pretty well, but he had a neck injury going in, so we had to really be limited in what he did to do that. And he did pretty good with his limited work that he was able to do, but getting him back to even getting in the competition was huge.
Right, and traveling, because that's a long trip for a dog, and
long trip.
Just making sure. But I love the working dogs, the search and rescue dogs, the military police, the service dogs. I love keeping them working. Yep. I've gone to different bases and worked with different police departments and just trying to help them evaluate their dogs. And
because those dogs work hard.
They work so hard.
I mean, they're running, they're biting.
Yeah, and they're sitting in the car waiting for a call, so they're not getting the warm up and cool down and all of that. So
the bomb sniffing dogs are pretty easy.
But during my residency, I got to go to one of the major airports and see how they work and asking the handlers different questions and what kind of injuries they see and what their job entails. And I had to go to various different sporting events and working and all of that. So I got a lot of exposure, and it was just incredible. And I have such a respect for what they do and the connection that they have with their handlers, and going to some of the military bases and just seeing how amazing they are, what they do, and how well treated and loved they are.
Yeah, we work with at least 3 different police departments over here, and those dogs are they're amazing at what they do. They scare the pants off of me, but thank God they wear muzzles, and most of them are actually really, really great. But just think about what that does on their body, laying from doing nothing to jump out of the car and going to a full-blown sprint. I mean, it's not like you and I would want to do that.
Right.
And the military dogs obviously goes without saying what they do. But then another thing, I think that, I wasn't really appreciating that before, but one of the things that I think was the kind of bread and butter of my practice before, and what I loved to do, was just older dogs. Just so many, and we'll talk about them later, but so many things, as we get older, as we know, whether it's, obesity, weakness of muscles, muscle degeneration, neurologic problems, tendon ligament issues. I mean, I think if you say an older dog, I mean, it kind of sums up the whole kit and caboodle of what we do with physical therapy, which is so wide, Yeah. And that's something that, I think every physical therapy center will do different things, right?
Yeah, they all do a little bit of different things. Not everybody has all the tools and the toys, but, it also depends on the person's experience and what their training was, and and also the area they live in. I think that definitely plays a role. But the goals of rehab, number one always has to be pain management. You can't ask an animal to do exercise. We had a lot of people that come in here and they're like, I always ask, what are your goals and expectations? And you'll hear, well, I just want to get them strong. But we'll go through and we'll find a lot of areas of pain. And it's we have to address pain first. We have to address pain first, and then restoring their mobility. We have to improve comfortable weight bearing and range of motion and muscle flexibility. And then depending on if they had surgery or an injury, there's phases of healing that we have to address. So if you're early on in your phase 1, phase 2, it's going to be very different than a phase 4 healing. So a lot of that goes into play, and then what medications, supplements. There's a lot that goes into these evaluations and making these plans, and it's very fluid. Because let's say we start something and the dog is just doing exceptional, and we can maybe, if especially if it's we're later on in the recovery where we're not worried about re-injuring or something like that, just saying, oh, you're doing really well, we can advance you this much quicker, versus a dog that we're like, oh, I think we can do this, and they're just really struggling and their form isn't good. So I reel it in and I'm like, okay, if your sit to stands aren't good with your posture and the dog's shifting, can't hold a good sit, let's do modified. So there's so many things that come into play, and there's a lot of communication between the client and the staff, because how did they do, and were they sore, were they great, were they energetic? So there's a lot involved, and we have a really great team here that I'm fortunate to work with, because it's very, very physically demanding, very hands-on.
We were joking the other day, if you don't have a back problem starting this industry,
you will. You will. I love, you get these technicians and assistants and stuff that will start, and they'll be, young and spry. They'll be like in their 20s, and then you kind of see them like, oof, getting up a little slower. And I'm like, I feel you've been doing this for decades.
Yeah,
and
my knees aren't the same as they used to be. That's for sure.
It's
hard.
We're
on the floor all the time.
All the time.
But I think one of the things that Dr. Varco said is that's really needs to be teased out a little bit is, one, what is involved with a rehab exam is not remotely like any other exam that you've ever had. I mean, everything from basically every joint in the body is evaluated, from mobility, flexibility, muscle girth is measured. It's so impressive of what you guys do. So it's really, when I refer a case to Dr. Varco or any other doctors here, I know that exam is worth it, and worth its weight in gold for the client. And also, it's, as she said too, it's very individualized. I mean, you can watch exercises on YouTube, like how do I rehab my dog's knee? But is your dog ready for that level of exercise? And that's the thing, is it's so individual. I mean, you may have a young athletic dog who's got good muscles, and he's ready to go, and just got to get over that pain level. And then, but you also have those old dogs that take some time, or young dogs that don't heal as well. So it is individual, and paying attention to your individual animal. And as Varco said, just to sit to stand, or are they doing it right? Are they in the right position? Are they stacked appropriately? So if they do that exercise inappropriately, it's not helping. Right. It's just like going to the gym. You do something wrong, it's, one, can hurt you, but two, is not, focusing on the area you want to be focused on if you're not doing the motion correctly. Yeah, quality over quantity. Yeah, I think that's really important. And, touching on what rehab therapy involves, it's, obviously, I think the thing that everybody looks at is hydrotherapy. So do you have an underwater treadmill? Because that's a sexy toy. That's a sexy toy, and it is. But there's a lot that has to be done besides that. And therapeutic exercise is honestly so important, because that's where we work on balance, coordination, core strength, that's functionality. I mean, it's so important to have that. Yeah. And so that's really, really important. Manual therapies, I can't stress that enough. I think those two are probably among the most important, really doing some myofascial work, some joint work, spinal manipulation therapy if somebody's trained in it. And then, of course, the hydrotherapy, the underwater treadmill, gait, mobility training, conditioning for the dogs that are ready for that. And conditioning does not have to be just for the working dogs and professional, organized athletes. Most dogs are athletes. Dogs are going hiking with their owners. They're going running with their owners. They're running in the yard chasing critters. They're all athletes to a certain extent, although we have a few patients that are not. But conditioning doesn't have to be that. And then assistive devices, right? So there's so many different assistive devices that are part of what we do to help support mobility, and use it as a bridge to walking, like carts and wheelchairs, or for, just keeping their paw placement correct when they're walking, traction aids. There's so many different things, and not everything works for every dog. So I think it's important to have that individualized assessment and plan. For sure. I think the other thing too is, with the individualized assessment and plan too, is just realizing that, a good physical therapist isn't just doing, manual therapies, water therapy, laser therapy, shockwave. It is truly an integrative system of what happens. I mean, we work with the neurologists, we work with the surgeons, we work with the oncologists. And, if a dog needs pain medicine, they better get that pain medicine. It's not like we're only going to be doing massage and these exercises. We're going to work with the primary vet as well, and make sure that they are getting good pain management.
Right.
Even myself, I had a shoulder injury that I was dealing with for a while, and I did all the physical therapy exercises, and it wasn't getting better. And I finally got referred to a sports medicine doctor, where I got diagnosed with a bursitis and got an injection in my shoulder, and then I can do the exercises and things worked better. So, joint injections is one of those things that we do quite frequently too. But it's just important to just realize it's really, whether we're talking about nutrition or we're talking about weight management or we're talking about pain management, it's this whole compass of what truly is a holistic functional medicine approach to care for your dog.
Yeah, that's why I love this field so much. And I wouldn't do right by my college if I didn't talk about the American College of Veterinary Sports Med and Rehab.
That needs to be brought up, because there is different levels of what we're talking about here. So, and everyone should be aware of, you're not going to go see a non-doctor for a doctor problem, right? So, you should see a veterinarian for a veterinarian problem if need be. But go ahead and hit it.
So, we have amazing veterinary rehab practitioners, which could be veterinarians, veterinary technicians, physical therapists. They can take a certification course that talks about, the different conditions and the different modalities. And it's, a few months long, and it's a very intense course. It's very good. But then there's, the next level up, just like you have a cardiologist, you have a dermatologist, you have a neurologist, you have a sports medicine and rehab specialist. We're all part of the, American College of Specialty. We became an official specialty in 2018. We were provisional in 2010. And basically we go through a residency program. We have to have publications and case studies, and it's a really intensive training program. And I think it's really important to bring awareness to the college and what it is and what it does, and how we work really closely with general practitioners, rehabilitation therapists, other specialists, neurosurgery. I think also in humans, rehabilitation or physical therapy in humans, it's a standard of care after injury, surgery, aging. I mean, it's part of what happens. And in veterinary medicine, I think it's going to start being more the standard of care. We have a few hundred diplomats around the world.
I was going to ask, how many are in California? Do you know of? That's
well,
where we are.
There's like 5 or less.
Yeah, so it's new. And kind of just to that end, I mean, just what Dr. Varco is talking about or thinking about is, let's say your dog comes in for a surgery, for example. I can do a surgery. I mean, I'm a veterinarian. I've done lots of surgeries before. But I think you would rather have a board-certified surgeon doing a TPLO or an ACL repair or CCL repair on your dog, or a limb amputation, or fixing a fracture.
Hip replacement.
Hip replacement. I had one of those the other day. It was crazy. So yeah, I wasn't going to do a hip replacement or a femoral head ostectomy. Some of those surgeries, if not done right, carry a lot of secondary complications that you don't want. So this is what we're talking about, is that there are different levels. I can do a knee surgery, but I probably shouldn't, because there are other people who are better at doing it. And not to, poop on anyone doing physical therapy, but there's just different levels.
Absolutely. And like I said, I've worked with amazing ones. And when I quoted the number 5, that's canine diplomats. We have a lot more equine diplomats because the college is canine and equine.
Right.
And so when you do your training, you're going to be equine focused or canine focused. But when you sit for your specialty boards, you have to know both.
Right. Oh, God, did you have equine too?
Equine, human.
That's horrible.
Canine. And then just a lot of the basics, right? And then cats were kind of sprinkled in.
Really?
But just because we're the canine diplomat does not mean we don't see cats and love cats.
Right.
I remember one time somebody being like, well, she's boarded in canine sports medicine, so she doesn't see cats. And I'm like, no, wait a minute. That's not the case. We,
Yeah, You don't think there'll ever be a board for feline, do you?
No, because we learn
Right.
stuff on cat. We
Right.
learn the feline stuff, and there's some literature. It's just, studies have shown the percentage of people that take cats in to see the veterinarian versus dogs, and
Right.
it's such a small number.
Right.
But, anybody who does rehab therapy is going to include cats. Maybe not everybody's going to do rabbits and rats, but they'll
Right.
do dogs for sure, or horses. And a lot of people that do horses will do dogs or cats because of barn cats. They'll do a little bit of stuff. So I think just asking somebody what your comfort level is,
Right.
and what,
Of course.
and then we all have like the things that we love and don't love, but
Don't forget chickens too. We've done
chickens. We've done chickens. They're so rewarding. They're so rewarding. I don't know. I just think for me, because my focus is pain management and mobility,
Right.
whether they had surgery or not, or, injury or not, just to be able to see improvement, whatever that looks like, because
Sure.
it's going to be different for everybody,
Yeah.
is just like really rewarding. And I'm really lucky that I have a great team here that, I trust to help these guys get back to functionality, independent functionality, and comfort and all that.
I think we're all on different levels, as far as veterinary medicine and animal rehabilitation, et cetera. But if you think about the simple stuff, like if you go to your I always hate this term, your normal veterinarian, because it makes it sound like we're abnormal veterinarians. But your normal veterinarian, or your normal doctor for that matter, when you're in pain, what happens? What do you usually get? You get pain medicine, right?
Right.
So, you'll get NSAID of your choice, whatever it might be. You might get gabapentin, you might get a muscle relaxant, you might get some supplements, but there is something missing. That's not a very holistic approach, right? It's like you have a whole body that there's muscles, there's joints, that need to be worked out and stretched and flexed and strengthened. And so, while we separate these things, it's just important to think about the body as a whole unit. And again, not just the muscles, but is your liver okay? Because
Right.
there's certain things we can do. And the heart's a big one, right? I mean, you're not going to be throwing your animal in the underwater treadmill when it has a horrible heart problem, So that's where the individualized care and the total care for the animal comes into play. So, but anyway, so a little off topic there for a little bit.
It's on topic.
Okay.
Yeah,
Good.
it's okay.
Just
it's on
some
topic.
tangent.
No, it's okay. I think this is such a fun topic, and it really does incorporate everything. I've had clients come in and just, their primary care veterinarian hasn't really diagnosed anything, but their owner, is like, there's just something off. And with our assessment, we're able to really identify the things that need improvement, and
Right.
we're able to address that and do that. There doesn't always, you don't have to walk in the door with a diagnosis. We will help you reach that diagnosis, right? Because part of my job is to figure out what I'm treating.
Right.
And so sometimes people are like, well, I'm not really sure. I didn't really get referred. I'm not really sure what's going on, but something's not right.
Right.
And we end up getting a lot of those cases. And then we dive a little deeper and we
Yeah.
figure out what's going on.
And sometimes we can do them in-house, like your normal veterinarian, where you take x-rays or do blood work or do some specific ultrasounds or whatever. But whether it's musculoskeletal ultrasounds, that's really cool, by the way. But sometimes we do have to refer out to a specialist to get a CT or an MRI or some other, a neurologic assessment, for example. Someone might be coming in for pain, and then we're like, that dog's neuro.
Yeah.
So
Yeah.
you got to go see a neurologist. So it's kind of cool because we do get to diagnose and do all that kind of fun stuff as well, not just treat.
Right.
So
Yeah. It's very well-rounded specialty.
yeah, very much.
Yeah. So there's been ample evidence supporting rehabilitation therapy, and then a lot of it are specific modalities, right? Like
Right.
shockwave therapy has a lot of, and it also depends on the type of shockwave that you have and the different protocols that are out there, but there's a lot of evidence on photobiomodulation or laser therapy. pulse electromagnetic field therapy, and we'll dive in to go through, like, we'll have a whole episode on PEMF, the pulse electromagnetic field therapy, but just how much evidence is out there is a lot. So we just tried to pick a couple of...
I mean, it's crazy. I mean, if we're going to go through here, you're going to hear me flipping through pages because we have a lot of stuff here, but if you're going to talk about, like, different therapies, different things that we do, I mean, there's that section, all that stuff that we had written down. Oh, I must have messed up or put it somewhere else, but, I mean, we can have an episode on just about, therapeutic exercises, manual therapy, hydrotherapy, joint injections, freaking musculoskeletal, ultrasound, shockwave, all that kind of stuff. There's so much that
There's
happens.
so much.
Acupuncture, spinal manipulation, massage, light therapy, whatever. There's, God.
And there's more and more evidence coming out. A lot of really good papers are being published. It's just, it takes time. It takes time to do the research, to publish it. So we're getting there. The college is growing. Yeah,
in your area too, whatever area you happen to be listening from, there's a website for the college to find out where practitioners are, but you can also do just a search to find out where, who's doing rehabilitation in your area. And if you don't feel like you're getting the total picture from your health professional, then seek them out. Obviously, check those people's references and make sure they are certified, because I think that's a big deal.
It is.
There
it
are
is a
people
big
who
deal.
Are not certified.
Yes.
Right.
Yeah. And so, there's a lot of great, Canine Rehab Institute, CRI. There's University of Tennessee. There's, North Carolina. There's a lot of different.
Doesn't
so
the
many.
Institute have one now too?
She has one. Healing Oasis. Like, there are a lot of rehab certification programs. So making sure somebody went through the program that they went through and got certified, I think that's just really important. There's a level of care, a standard of care there.
Right.
And so looking for that level. And there's a lot of people that just kind of learn it along the way, and I think that's fine. But when you go through these programs, they're very specific on, this is the literature, this is how you do it. You can't just read an article and be like, oh, I'm going to be able to do joint mobilizations. Right. So I think for the people that take the time, it also shows an extra level of passion and care when somebody cares enough. And I understand financial and time constraints, because it is very time consuming. It's very expensive to do all of that. But if you find somebody who's rehab certified, I think you're going to be in better hands than somebody that kind of dabbles a little bit in it.
Right.
Yeah.
Yeah, and just think about all the different, what was I going to say? I was just going to, is there a downside in doing rehabilitation? I mean... Time and money.
But if that's even a downside, right? Because what you get out of it is...
It takes time, there's no doubt. But when you think about downsides of stuff, like... If I'm going to give you a drug or do a surgery, I can pretty much tell you there's going to be a side effect or likely side effects to almost every drug. Just pick up your bottle of Tylenol.
Right.
Maybe I shouldn't have used that example today. but ibuprofen, maybe. I think that's still safe. Is that still safe?
I mean, they all have something, right?
No, but they all have side effects. But rehab, I mean, unless we're pushing your dog really hard, which an experienced person's not going to do, there is no downside. The downside is...
Not doing anything.
Not doing anything, right? And like Varco said earlier, time and money, which when I always talk to people about, like, diets, for example, I always say, like, well, which do you have more of, time or money? Because if you have more money, then buy the food. If you have more time, then make the food.
Right.
So there's different things, when we have those decisions to make, of course. But that's also where insurance comes in, right? I would say a fair amount of our patients have insurance. Way more in California than I think is the national average as well, is when I talked to an insurance rep recently. But that's where it comes in the hand, like if you have to have, we're going to go into some research studies here in just a second, but if you have some of these, like one of them we're going to talk about is a back surgery. By the time you get done with that back surgery, you might be dumping, I don't know, 10 grand?
Easy.
Maybe more. Cancer is another one. You're going to be dumping 20 grand. Heart disease you can dump a bunch into as well. But the point is that things like, it's time and money. So one thing to help with the money aspect would be insurance. But also, really, there is no downside to doing it. And you do actually end up bonding with your animal even more.
Absolutely.
Because now you're more hands-on than you were before, and you get this better relationship. So really, if there was a pill bottle that said, animal rehabilitation, side effects include, better bonding with your pet,
right?
Better strength with your pet, right. Longevity, stuff like that could be really important. So anyways, just think about that.
Yeah, I think that's a great point. And, obviously I'm a little bit biased, so I do think it's a really important thing.
Me too.
But, yeah.
You want to hit some research?
Yeah, let's hit some research. So
which one do you want to cover first?
Let's do the TPLO study. So TPLO, tibial plateau leveling osteotomy, is one of the most, if not the most common orthopedic surgery done, because cranial cruciate ligament disease, or ACL in people, is a very common thing. Right. And in 40 to 60% of dogs, it's going to happen on both sides. So there's double surgery or rehab or prehab or whatever.
Insurance, insurance.
And the insurance can really help.
Right.
I've definitely seen over the years, probably the first time somebody brought me this insurance form and was like, "Can you sign this?" We're all like, "I don't even know what this is. How do you fill this out?"
Right.
And now it's automatic. Yep. And I just think it's a game changer for
100%.
vet med. But this study came out, and it's a 2015 study, so it's fairly it's not super dated, but it just kind of shows that we had these dogs go and have surgery, and they had two groups. One had the traditional treatment after TPLO, where they had restriction to cage rest and leash walks, and then the other one had rehab program, and it was performed by a certified practitioner. That's really important. And basically what they found was that the rehab group was 1.9 times more likely to reach full function at 8 weeks, which I would just like to say, in human medicine, they're rehabbing these for
right.
It just seems forever. And
right.
in dogs,
right.
we're just like,
2 months go.
Yeah. Well, somewhat go.
I know it's not go.
I know, but
right.
A few more weeks and they're already like, yeah, you can do this and that. But anyway, by 8 weeks. But the traditional group, remember these
2 times, so it's twice as likely, almost 1.9. So it's pretty impressive.
But then you get the traditional group, the ones that just did leash walks and, hey, don't jump and use stairs and be crazy. They were 2.9 times more likely to have unacceptable function at that 8 week. So that's a very different number there. And by 8 weeks, by 2 months, that's where we really look for bony healing. That's where you'll have a follow-up with the surgeon. They'll repeat radiographs or x-rays to see like how much the bone is healed. And there's a lot of factors in that. But that's huge. Right. Because we get a lot of these dogs that by 8 weeks, I'm like, oh, they should be using their leg a little bit better. Right. But we see them 6-8 weeks after surgery, 12 weeks after surgery. Right. There are still some practitioners out there that do the traditional route. Hey, you don't need to do anything. Start rehab at 2 months. Right. We've kind of missed the boat a little bit, but I say it's not too late.
No.
People get, really stressed out sometimes where it'll be 12 weeks out and they're like, oh, I didn't know about this. Nobody mentioned it. I should have come earlier. And I'm like, you're here now. Right. That's the important thing. You're here now, and there's still a lot we can do. Yeah. So I think that number alone is just really important. And what this study suggests, that rehab performed by a certified practitioner is safe and may improve that short-term outcome. Because remember, short-term, they only looked at the 8-week mark. So that's still really important. I think coming off of surgery and starting off right away is just so important. We're going to get less muscle mass. We're going to get less restriction of range of motion and muscle flexibility and things like that. And I just think that that's a really nice, quick study to highlight that rehab therapy after a major orthopedic surgery does show that these dogs do better.
Would you ever, like I said with my wife, when she had surgery, you would never do an ACL surgery on a human without physical therapy. That just wouldn't happen. That would be considered malpractice. And, we start seeing them at 2 weeks usually.
Yeah, we'll do a recheck at 2 weeks after surgery. Some come in for prehab.
Those are awesome.
Which is really great because one, we're acclimating the dog to the equipment, and they kind of know what to expect, and they're more comfortable because we do fear-free handling. Most of us are fear-free certified or fear-free trained, and I just think that that's such a game changer in vet med altogether.
Right.
But dogs don't go into a big glass box that fills with water on so it can be really scary. So I think
with the ground moving.
Yes, with the ground moving. So these things can be really scary and frightening, and if we can get them in before they're painful and stiff and recovering from surgery, if we can see them before, even to just introduce them a couple of times, hey, this is what, and there's a lot we can do beforehand, getting some laser therapy on those areas, manual therapy, getting that assessment before, I think it's really great.
Yeah, it's just interesting to think about all the things that happen after surgery. I'm assuming most people listen either have had surgery, or I'm sure everyone's known someone who's had surgery if they haven't themselves, but it's, there's a lot of biomechanical changes that happen, We all know that, like, for instance, if your knee hurts, you're going to put more pressure on your other knee, and then you might walk stiff-legged. That's going to put more pressure on your lower back, and, all these different biomechanical or compensatory mechanisms that we do to try to make ourselves better come with negative consequences. So
Absolutely.
I think that's interesting, that we don't routinely recommend rehab. I do wonder sometimes if it's just the old way of thinking about things, or if it's just,
I think so.
It's a cost thing. Maybe veterinarians are also concerned about cost, because it is an expensive surgery, right?
It is. But, like I mentioned before, rehab therapy it's been around for a long time. The college is fairly new, and there's a lot of surgeons that I've talked to that are like, well, the dogs did fine before.
Right.
They'll do fine now, but we know better, so do better.
Yeah.
And like you mentioned, the compensations. I know, right? Well, I've met veterinarians, and I know we talked about this before, that didn't believe that animals felt pain.
Yeah.
So they didn't, they would do surgery with propofol and iso, which propofol is an induction agent to get them under anesthesia. Isoflurane is an anesthetic. They don't manage pain. No. So I think medicine is changing on the human side, the veterinary side.
I've been doing this for 30 years. Marco's been doing it for a long time as well, and just the difference in anesthetic protocol just makes me think about, we might use 2 or 3 different pain medicine techniques. Maybe we use anywhere from 2 to God knows how many, 5, 6 drugs at lower levels to accomplish a good goal, which is really cool compared to what we used to do, So.
And local blocks. I think local anesthesia has come such a long way, and that can make such a difference.
Yeah, it is amazing. But back to the rehab thing, though, it's just, think about what happens after surgery, and, joint stiffness, muscle loss of range of motion. Yeah, we can get them back, but obviously not losing it would be better than getting it back.
Absolutely. And animals and people alike, we don't get injured in isolation.
No.
It's not just the knee surgery.
Right.
It's what you said.
Right.
It's everything else. Yeah.
Yeah.
So I think, again, I don't see a downside to getting a dog or a cat or a ferret or, anything into a good structured program. And something I do want to mention is I do see quite a bit of people that come and they don't necessarily do in-clinic rehab. We see a lot of cases where we develop a home therapy program. And so I'll do a consult, and it's like, hey, let's work on these things, and let's reevaluate you in a month or 2 months, and then change things up. So even if you think, I'm not going to go to rehab, or, hey, this place is too far for me to go regularly every week or twice a week, there are still a lot of practitioners that will put together a home program, because we have people that will come from LA, which is a couple of hours away, and they'll do in-clinic rehab. They're amazing. I'm like, thank you for doing the drive. That's quite the drive. But a lot of them from LA and Orange County, and even more north than that, will come. They'll get assessed. We'll develop a program for them, put them on pain medication, touch base with them, and then just do periodic reevaluations. I think that's a great way to do rehab therapy.
Yeah. You know, the other thing I was thinking of just recently is that we need to start doing more of, and it goes along with these rechecks and from people far away, is, you know, in this state at least, you're able to develop a doctor-patient-client relationship with a video call. And I think one of the things that would be wonderful to start doing is more rechecks on the video calls and stuff, just so people who come from far away are still getting handled appropriately. There's caveats to everything, of course, but it's an interesting modality that's now available to us to do, which is wonderful.
Yeah.
What do you think about, we didn't talk about this before, but what do you think about rehabbing knees that haven't had surgery?
I think it depends. We see everything. A lot. I know, right? That was like my favorite thing from learning acupuncture. Right. It was they would say it depends.
It all depends.
It all depends.
Yep.
We do see a lot of non-surgical, medically managed knees for cruciate, and the size of the dog matters. They've done studies in smaller dogs. The breed matters. You know, boxers just rehab a little bit differently. I think the expectation and what their function matters, because the surgical technique matters, right? So some dogs you can do a TPLO, and others you're going to do an extra cap, which is a totally different procedure. But if you have a small dog that maybe doesn't do too much and money's an issue, I always say talk to the surgeon and see what the surgeon thinks is appropriate. But there are so...
Again, goals too, right?
Goals,
what are your goals after this? You just want him walking, you know, less painfully, or do you want him running?
Right.
What are your goals?
And the goal of surgery, I think people need to understand, is we are reducing instability in the knee. They're still going to get arthritis.
Right.
They've done studies where they've transected the cruciate ligament and in the same surgery repaired it, and those dogs got arthritis. So it's very clear that, you know, because I'll see dogs that had knee surgery like 4 years ago, and their knee is like super thickened and stiff, and people are like, well, I'm here because I don't want them to get arthritis. And I'm like, somebody did not explain to you very well, or you missed that part of the conversation. So the goal is really to improve their biomechanics, right? So we're not fixing the ligament like they do in humans. It doesn't work in dogs. But I do think that there is a place, and I'll assess the dog, and I'll have a very honest conversation, and then my discharge is like 4 pages long. So I'm like, you can do X, Y, Z. But in some cases, it's like, look, based on these factors, I really think just going to surgery sooner than later is going to be, you know, you go to surgery and you have that 12 to 16 week recovery, and you're done. You do medical management, 6, 9, 12 months later, you're still having waxing and waning pain and lameness and muscle atrophy. And I just think in some cases it works. And of course we have patients that have cardiac disease, aren't good anesthetic candidates. If you're looking at surgery's too expensive, but I'm going to do a formal rehab program, the surgery you're paying out front, but 6 months of rehab, you're going to be paying, right? So regardless, it shouldn't be the quote unquote less expensive one. It's just, do you want to pay it all at once, or do you want to spread it out? But we have medically managed some knees successfully. I always tell people, or at least I try to, hey, we can try it and we'll reassess, but you may end up going to surgery anyway. I don't want people to come in and think, hey, we're just going to do medical management and this dog's going to be fine.
Yeah, and that drives me a little bananas too, because again, like you said, age, you know, what we would call patient selection, but age, comorbidities, breed, et cetera. And, you know, we have a lot of people who come in who want no surgery, and that's fine. At the end of the day, sometimes they need surgery no matter what, and, you know, I guess we can consider it prehab then, I guess, in those cases. But one of the things that drives me bananas is I'll be on Instagram or something, and because I do, you know, acupuncture and some chiropractic techniques and massage and joint injection, sometimes I'll see these dogs and people will post them, these professionals will post pictures of or videos of their dogs and like, look how much better he's doing 8 weeks after just doing acupuncture. And I watched the dog walk, and I'm like, no, that dog's not doing better. Not only that, his muscle loss on that one leg is tremendous. So there's a lot of things to think about what goes into it. And not all dogs are right for surgery. Like you said, all these comorbidities and so forth. Does a dog have Cushing's? Is a dog overweight? Has he got a grade 4 heart murmur? Is he 17 years old? So, sometimes these things are important, but I would still say the gold standard for most dogs is to do surgery. Just as a general summary, but that doesn't mean for everybody, but as a general summary. So
and if the meniscal cartilage is involved, managing that medically is just like, they're just going to be in pain. And but I'd say that's a great conversation to have. And I have people come to me that walk in the door and they're like, I don't want to do surgery. And that's fine, right? But I do have that honest conversation where I say, I at least want you to get a surgical consult because I want you to have all the information on the table before making that decision. And I have to tell you, I've had a lot of clients that have that surgical consult and end up saying, oh yeah, I do want surgery. And then we rehab their dog, and their dog is back to hiking a few months later, and they're really happy they did it. So when you make a decision like that, don't Dr. Google it. There's a lot of great information online, but go see the person that's going to do the procedure or could do the procedure. Get that information from them.
Yeah, I think people have like this. We all have biases in our lives, right? And people have a bias that one, surgery might be bad, or two, that it's going to be so invasive to the dog, or it's too expensive, or whatever the bias may be. But when you start thinking about, I'll do surgery, and then 8 weeks I'll be this, and 12 weeks I'll be here, 16 weeks, whereas if, you don't do the surgery 9 months later, you're still waxing and waning pain, you start wondering, did I make the right decision? Did I not? So it's a tough decision, and like I said, it's all individual based on, the patient. It depends, is what we always say, but I've had the same. The other thing that's really frustrating, right? You medically are managing these dogs, and they're doing good. You're 4 months out, like, oh my God, he looks really, really good. And then, unfortunately, just like me, I have torn meniscus in both of my knees, and I haven't had surgery. I can't really run anymore like I used to, but I can do a whole lot of other things. But having said that, these dogs are out 4 months, and all of a sudden, you can't tell them not to run. And all of a sudden, they go running, and now they need surgery. That happens all the time. Drives me bananas.
And it's just so hard. I just think if there's any question, just go in and talk, start with your primary care and go from there. I've had some, and I put successful in air quotes because success is different for everybody. But I've had some dogs do medical management that are comfortable. They're moving really well. They're maintaining their muscle mass and even building a little bit with formal rehab. Like these are the dogs that are coming in and the clients are doing their home therapy exercise, because I do get a lot of people that come in and they're like, well, I'm not really doing the home stuff. Kind of important, especially when they're coming in once a week. But I do realize that everybody's life is a little different, and I don't live with that person, so I don't know what their limitations are
what their life's like.
And what their life is like. So I don't judge. I'm like, okay, let's make it easier. Let's do these 2 exercises during the walk. So then when you get home, you're done. And maybe you just have to do like a 2-minute stretch at, once a day, every other day. I try to meet my clients where they're at, because I'm not doing anybody any good if I'm like, do these 4 exercises. Oh, you're not doing them? Okay, well, that's it. Like I'm not doing my job if I don't find a way to help that dog get what they need, or cat.
Exactly. Well, we can talk about this forever, but do you want to jump onto the DM study?
So this was a study that was 2006, and it was a really big study in the sense that they looked at degenerative myelopathy, which it's like Lou Gehrig's disease in people, and there is no cure, unfortunately, and it does progress. And there's a lot of factors, and we can definitely have, more than one episode, but definitely a whole episode just on degenerative myelopathy, or DM. But this study compared 3 treatment groups, right? So you had your dogs that they did not have any rehab. They just live their life. Then you had moderate rehab therapy where they did daily walks and stuff at home, and then they would go in, once a week or whatever into a formal rehab program. And then you did intensive, so walks and stretching and range of motion, and they would go into the rehab center more than once a week. And basically what they found was that the dogs that had intense rehab therapy had survival time an average of 255 days, but the dogs that didn't have any rehab therapy or any kind of treatment, the average lifespan was 55 days. And then the intermediate was like 130 days. So that was still pretty good. If you can't go all out and go into the rehab center, multiple times a week and do extensive rehab at home, you can still get, and these are just averages, right? Some were more, some were less. And there's so many factors because fecal incontinence is huge, especially you have a German Shepherd dog. That's a big dog that's incontinent, that can't walk. For some people, they call it. Yeah. And other people are like, no, I'll put them in the wheelchair. I'll clean up after them. Everybody has their... Diapers, yeah. Right. And people have their line of what they think is acceptable. And sometimes that line in the sand changes. Because you go into it being like, I couldn't have... Changes, it does, right? Because I've had clients say, well, once my dog can't walk, and then we're having the wheelchair conversation, and they're super happy. Right. Or once my dog is incontinent, I'm calling it. And then that happens, and they're like, no, I think we can manage it. So I think, again, it's a fluid process, and things change, but it is a lot of work. But I love that you mentioned the study when we were talking earlier, and I said, what studies do you want to talk about? And you were like, I think that DM study is a good one. And I love that you said that because it's such a great study. No, we're not saying we're going to fix this. We're not saying we're going to, but it's the quality of life. It's the longevity and keeping them happy. And it's a lot of work, but I think it's a great study to highlight.
Yeah, I think, the reason why I wanted to focus on that study for at least a little bit was just the the magnitude of difference. And I know intensive rehab is intensive, but the difference between 55 days to 130 days is huge. And the difference between 155 days and 255 days, I think that was a number, is bananas.
Yeah.
And, as a veterinary professional, seeing DM is never encouraging because you know where it's going to end. Right. But I guess it's somewhat like being a cancer doctor. I mean, a lot of times cure is wonderful, but oftentimes doesn't happen. It's really quality of life, and that's something we didn't really even talk about with this study too, but quality of life and time. Like how much time, what is that worth? That extra, 200 days.
Right, that could be an extra birthday, it could be an extra holiday.
More time
memories.
With the family. Yeah, exactly. And then
bucket list.
Right, quality of life, because DM, degenerative myelopathy, I think classically we think of it with German Shepherds and Corgis, right? But man, I've seen it in boxers and pit bulls and a bunch of different dogs. And there is a test for degenerative myelopathy, by the way, and I want to bring that up only because, oftentimes if you're doing all these things and you're like, oh, what's wrong with my dog? And you do that test, it's at least right? I mean, it's not a terribly expensive test either, so at least and I know there's several universities and places that do that test now.
Yeah, it's a salivary swab.
It used to be blood. Remember back in the day it was all only blood, but now it's salivary.
People can order it online, and it's a great test. It's not a definitive. It's not like you have it, you don't.
It's a gene test, right?
Yeah, right. And you have to... It's a diagnosis of exclusion, meaning you start to cross things off. It's not this, it's not that. And that test can be so helpful. But if it's negative, you're like, cool, it's not it.
Right, yeah, so if it's negative, it's cool, it's not it. And if it's, if you have both of the genes, then it's highly likely. If you have one, it's like, maybe. But it's an interesting test. But the degenerative myelopathy, if you've been fortunate enough not to experience it, it starts with difficulty getting up, dragging the back toes, walking kind of funny, weak on the hind end, and then we'll progress all the way up to tetraparesis, and paralysis, so it's paralyzed hind legs, weakness in the hind legs, weakness in all four, paralyzed in all four, and
trouble breathing. It just progresses. Right. It's very sad.
I mean, the comparison to Lou Gehrig's disease is appropriate. So anyone who knows what that's like, it's the same. But to be able to have these dogs walk longer and, live longer and have a good quality of life I think that's what we're all here for anyways.
Right.
It's not like, we know we can't cure everything, right? But, quality of life and living a pain-free life and having time with, I don't even know what time is worth. It's invaluable. So,
right.
But that study, that's what got me. And I remember reading that study and I was like, damn, I knew what we did made a difference, but that's a difference. That's 55 to 255 or 55 to 130. That's impressive. So, and the goalposts do change all the time, right? It's like, I remember I have a dog right now who is young, bulldog, who was unfortunately not bred the best. But anyways, so she has to wear diapers. And when I first brought this dog home, my wife's like, why'd you bring this dog home? Of all dogs, why this dog has to wear diapers? And now we don't even think about it. It's like, she has diapers on. Who cares? We change them multiple times a day. Mm-hmm. We have little liners that go in them. She's got cute little diapers,
So they're so cute now.
Yeah.
Oh my
So
gosh.
many cute ones. My favorite are her pink or her purple ones. But, so we just know how to deal with it. And, I honestly, if I had an incontinent dog at home, a fecal incontinent dog, I'm like, yes, a lot better than urinary incontinence. Because if they have normal poop, I mean, all right,
Easy.
You wake up in the morning, you pick up a little log, and you flush in the toilet. Big deal, To me, it wouldn't be a big deal. But if you take that to somebody who hasn't dealt with that before, it's like, oh my God, that's nasty. But you get used to it, trust me.
Yeah.
And,
yeah.
It's not that bad. The urinary one's a little harder because your dog lays in it and gets urine scald, and you have to clean them up and yada 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 yada.
Yeah.
But anyway, it is interesting.
Not easy. I said easy, and I'm like, well, it's not easy. But you're right. It's easier to manage as long as it's normal and they're not having diarrhea everywhere and stuff that. But yeah, you're right. Things do just change, and sometimes people stick to it, and they're like, well, I can't manage it.
Right.
And
that's okay too.
And that's
there's
okay.
no judgment. It is what it is. Everyone has their own, like you said, line in the sand, and sometimes it shifts, and sometimes it's, if you have an immunocompromised person in the house, or you have a small house, or there's diarrhea, there are factors.
Yeah.
Do you travel a lot? Who's taking care of your dog?
And do you have physical limitations? Because we have clients walking in that they can't get on the floor with their dog. They can't, sling walk their dog. They don't have the force, or
the dog's big, the owner's small.
Yeah.
It's hard.
Yeah. Or they live, they have to use 3 flights of stairs every day.
Yeah.
And you're not gonna bring a Bernese Mountain Dog up and down 3 flights multiple times a day to get them out. Like, there's certain things that you're like, I can't.
Right. I mean, you have, the study that we want to cover next actually is going to be about intervertebral disc disease, or it'll be a surgical one. But just think about that too. You have a big German Shepherd that went down because of an IVDD or a bulging disc that needed surgery, versus a little pug or a wiener dog that you can literally pick up, with one hand, so not that you should, but you could. But it's but anyway, so it's just like, you got a 20-pound dog versus a 120-pound dog, and how big are you? Are you 200 pounds? Are you 110 pounds? These things do make a difference.
They do.
And it's as we said before, it depends. So.
You want to talk about that study?
I gotta find it in all these papers here.
Here, I have it.
Do you have it?
I do. It's highlighted.
Actually, you know what? Do you want to go over it? Why don't you go over it and I'll just make comments.
You want to do that? Okay. We're going to do that.
I kind of enjoy that because it involves less reading.
This is a 2021 study, so it's more recent, and it's a controlled clinical study of intensive neurorehab post-surgery in dogs with sudden, severe acute, so sudden intervertebral disc extrusion, so bulging disc. And they did this study just to show the effects of intensive rehab, and it had a pretty good number of dogs. It had 367 dogs with spinal cord injury, and they divided the groups into like the control group and then the study group, where they ended up doing like range of motion and medications and all sorts of things. And basically what they concluded was that intense neuro rehab shows promise in improving ambulation, or the ability to walk.
This is after surgery, is that
after,
right?
yeah.
Okay.
In post-surgical dogs with severe sudden bulging disc. And so it suggests that if you're doing intensive neuro rehab, you're going to reduce the need for euthanasia, and you can enhance recovery within that 3-month window. They kind of, some of these studies are within a certain period of time, and some of them are ongoing. It's really hard to do ongoing studies, so you have to have like, we're going to start here and end here.
Right.
And in that,
that's always hard.
Yeah. So they really did show that, and they did, range of motion, hydrotherapy. They did a lot of different things, and there's so many factors that come into play, but basically, intensive neuro rehab can improve ambulation success, particularly within 3 months. I think that's really great. With that being said, we've had dogs that are neurologic that don't show improvement till 6 months or 9 months. Right. I just had a tetraparetic, meaning all 4 legs are weak and affected. She had gone almost 11 months where she started out completely down. She could look at you by just moving her eyes. Then she started to be able to lift her head. And then she was eventually able to kind of like lift her head and neck. And what I love about this story, our sweet Zelda, she was very determined, but her family, her mom in particular, was just very dedicated and was just coming in. The staff was just so great. Like if she couldn't bring the dog in, we had certain staff that would go pick up the dog and bring her to
I remember that
dog.
Wow.
And she's not only walking, but she's running around.
Is she?
She is. I'll show you videos.
Seen her forever.
Oh my gosh, it is. The staff went and made like a cake and bought a cake, and we did a very big celebration. But that's almost a year out.
That's a long time.
And for the people that are like, well, if this is what it is, we're just going to keep trying, and we're going to do this to maintain her quality of life. And all of a sudden she like stood up, and we were like, wait a minute, what do you mean she stood up?
Yeah.
And then she took a few steps, and we're like, what do you mean she took a few steps?
Right.
And not that long ago, I get a video of her like running outside, and I just like lost it. Yeah. I was like, you are kidding me right now. And it's just so rewarding, and it's just such,
similar one too.
It's just great.
Yeah, I had one that was a little Pomeranian. I can't remember how old he was. He wasn't that old. I think he was probably like 6. And referred by another acupuncturist, which is always scary. And so this dog comes in, and he literally does exactly what you just said. Couldn't move anything except for his eyes. And so we did intensive care, some massage, some home rehab, some range of motion stuff, some electroacupuncture, aqua injections and acupuncture points, etc. And then like by the 3rd or 4th session, the animal was able to lift its head. And then by like the 6th or 8th session, it was able to sit sternal. And I remember joking with the owner. She was really funny. She really cared for this dog, and she had an incredible sense of humor as well. And so I said something to her like, well, one of these days, if you're, once the dog's walking, your next acupuncture treatment will be free. And, it's kind of tongue-in-cheek. And she calls me up one time that she wanted to talk to me up front. I'm like, I don't have time. But walked up front, and there he was, and he just followed me down the hall. I'm like, damn. And he lived, he died of something totally unrelated, like 10 years later. So it's definitely, this dog did not have surgery, by the way. Did Zelda have surgery?
Yeah.
Zelda did have surgery.
Yep. And we also did, the manual therapy, the home program, the in-clinic rehab, the electroacupuncture. She got everything.
So cool.
And wheelchair, and just, kind of going through the steps. But I think there is no better job. When I go through, work is work.
Right.
But to me, again, I'm biased.
Right.
There is no better job.
Yeah. When you get those rewarding cases, I know it's funny because I talked to a surgeon the other day who was like, I don't like those chronic cases. I just want to do my job, cut, and then be done.
Yeah, treat and street.
Right, treat and street. And to me, the rewarding cases is developing a relationship with the owner, is developing a relationship with that dog, and seeing steady improvements, whether it's over 4 weeks or whether it's over the lifetime of the dog, and keeping them stable like the DM dogs. Or, this study it's interesting. You didn't give the numbers, but the study group was as far as back to ambulation, right? Is that what it was? Back 58% versus the control group was 32%. So that's what, 26% more recovery back to range of, walking, etc., after surgery and intensive neuro rehab versus your standard. The standard was just cage rest, and that's a big difference. It's like almost 30% difference, and that's a huge number. If that's, heck, in the world of drugs, if you have a difference of 15, 20%, that's amazing. This is almost 30%. So that's pretty impressive. So again, another example of highlighting the benefit of the combined effort of all we have to offer, surgery and rehab, not just surgery or not just rehab.
And a lot of things are non-surgical. You've got your chronic degenerative joint disease, osteoarthritis cases where if they're just coming in, and a lot of those, we'll see them for the rest of their life. And it's maintaining, right? Like they're not, the people realize, so like, I know they're not going to go on a 5-mile run with me anymore, but I just want them to be comfortable.
Right.
And we'll see them every week. And it's super fun, super rewarding.
Right.
We're trying to slow down the progression and help them maintain comfort and mobility and dignity and quality of life. And those have to be some of my favorite cases.
I think it's interesting too is, as I've done this for a long time and as I've gotten older, you don't really appreciate, when you're young, you don't appreciate that you're aging. But I think one of the things that dogs have showed me is that we're all going to age, we're all going to suffer to some level or another, pain, lack of mobility, lack of cognitive function. But I don't know, dogs to me are a wonderful teacher on how to do it gracefully.
Yeah.
And I am humbled every day when I get to watch these dogs, and it is a great job.
Are you tearing up?
I tear up. I'm a baby.
I feel like you're tearing up right now.
I'm tearing up a little bit, but
I
love dogs and I love my job. So,
yeah.
Did we want to do the senior one too, or?
Oh yeah. Well, the senior one was more of like, hey guys, there's a lot of considerations in doing geriatric rehab, and for me, that's like my favorite thing on the planet. So I would literally,
oh my God, crunchy dogs.
I would open a super senior center and then just like
we call crunchy dogs.
Crunchy dogs, old crunchy dogs and cats. I to me, there's just nothing better than an aged anything, like people, animals. I just think there's so much love and wisdom and life and grit that comes with all of that, and they need us so much more.
Every time there's that one dog who comes in here, Maxwell right now, I think it's Maxwell or Max, little pug, and he comes in, old pug, and he just makes me smile every time I see him walking in the door. I don't know how old he is, but he's, his mobility is not great, but owners are lovely, and the dog is just always trying, so and but so many different things we can do. So many different
things, and it's so important because that with senior dogs, you can make such a difference. You're not necessarily curing anything. Some things, sure. But, just like in human medicine, that optimal aging, that healthy aging is such a big thing. And being able to do that more and more on the veterinary side, I think is huge. And basically this review paper just said, look, there's a huge need for rehab in dogs. And it goes through the aging and frailty and all the things that happen that really mimic a lot of the human things. So when you're like, I remember when I turned 45, I got this and that, and how, the ophthalmologist was like, once you hit your 40s, your lens changes and you're going to need reading glasses. There's some predictable, there's some predictable changes and some changes that just occur because of genetics or life or whatever. And I think this paper is just really nice because it's just saying like, hey guys, we need to keep working towards a standardization of care and keep looking for things that we can incorporate, especially for the most part, everybody's going to get old.
Sure. If you're lucky.
If you're lucky. And so it's one of those things that not everybody is going to need a cruciate surgery. Not everybody's going to need back surgery. But if you're lucky, you're going to get old. And we need to be better about how we can support them, and don't wait till they've already lost the muscle. Don't wait until they've lost the function. Like, let's help them age better.
Yeah, and I think that all the things we've talked about leading up to this is, the senior dog, I feel, is like the best example of what we can do, only because it encompasses so much, right? I mean, there is multimodal pain management. There is dietary stuff that we need to focus on. There is activity. There is mental activity. There's so much that is there. And by that time, too, I mean, if you don't have a bond with your 12-year-old dog you've been living with, I don't...
You're a monster.
You are a monster. I mean, if you don't have pets, you might be a monster, but it's okay. That might be my bias. But if you don't, I mean, like, what is wrong with something there? But yeah, I mean, I would do anything for my older dog. So I think that's true. And, you know, like some of the things we talk about, like obesity. I mean, our first episode was on obesity and how important it is. And in that study, I'm sure some of you may remember, but being mildly overweight versus being ideal for a Labrador Retriever ended up of a difference of 1.8 years in the lifespan of that dog. That's a huge number, almost 2 years for a Labrador. What I wouldn't give to give 2 more years with my dog. So
oh my God. Managing
obesity, our favorite word, sarcopenia, muscle loss, it's really important. You know, trying to make sure they're using that muscles. And you know, I used to have my old pug that would take me freaking 30 minutes to walk 1 block. Literally. I mean, I was literally shuffling my feet, but she loved it. You know, she was going out and sniffing, and, you know, we have a lot of people who just bring their dogs in strollers because the environment is so important, you know, and sniffing around is so important. So, yeah, taking care of these old ones are really important.
I know. And there's a lot of really wonderful organizations out there for senior and geriatrics on the veterinary side and just like the rescue side. And I just love
I know, right?
all of that. I just think it's amazing. And we've all adopted like hospice cases and seniors and special needs. And I just, for me personally, I know that's not for everybody. For me personally, that's like my favorite.
Yeah.
So.
Yeah, we've had, in my house, we've had 2 pugs, both of which were missing eyes, 1 eye each. I don't think my kids, when they were young...
Did they wear like a pirate patch?
No.
Did you do the googly eye sticker? Oh, that would have been great.
That would have been great. But I don't think my kids, when they were young, understood that they actually came in varieties that had 2 eyes.
Okay.
Yeah.
That's fair.
My young son, who was 5 at the time, goes, hey, look, it's just like Jack, except it has 2 eyes. You know, so it is funny. But yeah, we all, in the veterinary field, we're all adopting these... well, they're just...
Exceptional.
Exceptional.
Yes.
It wasn't the word that first came to my mind, but yes, exceptional cases. And we can do a lot of those for these rehab. So just don't forget that rehab isn't just for the young, the injured. I got a knee, I got a back. It's just for the whole dog, for the whole maintenance of this animal and the whole thing.
Yeah, and getting them off on the right foot. I do a lot of baseline evaluations. Like, hey, let's figure out if there's any deficiencies. I mean, just think about even the dog that has that gets spayed or has gastric surgery because of a foreign body, and they cut into the abdominal muscle. Once they are healed, let's do a core strengthening program. Like, let's focus on getting them, you know, back to optimal health and mobility.
I would love to see those more. I would love to see the dog who comes in who's like, "Now my dog is 12 or 13 or 14. And he's slowing down. I want you to just look at him and help me develop a plan." I wish I saw more of those. I mean, we see some of them, but it'd be fun to see them before they're down, before they can't get up, before they have urinary or fecal incontinence and so forth. But these are things that we deal with on a daily basis. But rehab, I mean, my God, we didn't even talk about all the modalities, but there are so many modalities we use, and that's where I think when I think about this term functional, you know, medicine and stuff, a lot of times I feel like we're already doing it. We've been doing it for a long time.
Yeah, we have.
You know, so anyway, but
I don't know. Great episode. We could keep talking for hours, but I think people would probably be like, okay, guys, come on.
We probably need to split this episode up into like 3.
I know. We won't, but we could. But then we'll come back with other, you know, rehab modalities and talking about a lot of different things. But
and if you guys want us to focus on on a modality or something in particular, whether it be shockwave or laser or musculoskeletal ultrasound or hydrotherapy or, you know, PMF or whatever, just maybe in the comments right below.
Yeah, and stay tuned because we'll do it.
Yeah.
And this season, we're going to have some additional fun things. We're going to have some guests coming on. We've got some really amazing people that we've reached out to, then made connections with, that are excited to join us on an episode. So stay tuned because we'll have some of that too. Yeah.
Well, thanks for joining us, guys. Hopefully we didn't bore you too much and you found it very interesting.
Yeah, thanks. Take care.
Adios.
Bye.
Bye.